Hi, myself Sampreetha Ranganatha. I'm studying MSc Global Health and Management at University of Aberdeen. I've did 10 weeks internship in Rural Health Campus as a Rural Health Policy Project intern. So my topic was infrastructure and funding allocation in the rural area called Powys. Powys is a small county which is in the Wales. So the purpose of the report is to assessing the healthcare issues faced in the rural Powys specifically, and identifying, recognizing the obstacles related to the funding, infrastructure, and digital accessibility, and to recommend tailored solutions that are sensitive to rural needs. Uh, what are the present problems in Powys? They are the most, as it is a most rural county and mountainous terrains. It is having the aging population, and in my research, I came across older people got excluded from the digital healthcare, or they face certain difficulties in using the digital health services, and there is no district general hospital, and there is a problem of poor broadband access. So what are the challenges? There are three main challenges, where one is the funding allocation, and one is the outdated infrastructure and digital exclusion for the older people. So in the funding allocation, it shows the report shows 400 sorry, the report shows 22.3 million of deficit, even though 400 million is exclusively given for the healthcare. PTHP, Powys Teaching Health Board, in its escalation notice mentioned they're facing the deficit of 22.3 million funding deficit, which shows present funding formulas are not effective in addressing the rural needs, or uh, they are not uh, effectively measuring the financial aspects pertaining to the rural needs. And as per some reports, like IMTP, Integrated Medium Term Plan, dated 23-26, it discuss about the outdated hospital buildings and digital health services. And even the board itself accepted they've been using some of the outdated services. For example, some of the systems were dated back to 1940s. There is some capital investment plans exists, but they only exist in the theory. They are not in the so my next challenge, which is present in the Powys, is only 47% of the total Powys population are comfortable in using the digital health, and but the older adults often face problems in using it. Also, the national plans which provide the significant guidance for the rural implementation, they're supposed to provide it, but right now it is not happening. And in the recommendation, the first recommendation is establishment of the funding prospects that addresses the rural needs, adapting the Scotland's NHS resource allocation committee model, wherein they spend the fund based on the needs of the rural area instead of considering the whole healthcare fund. They conduct the surveys to know how what is the elder population, or what is the requirement around the area. So based on that, they allocate the funds according to the rural needs. So Powys, even facing the similar problems, can try to adopt that, and including the factors such as rurality, travel distance, and workforce strategies while planning the funding formulas. And providing fair needs oriented healthcare is essential. Then adopting the rural health infrastructure fund. Rural health infrastructure fund is a dedicated fund for the rural capital initiatives and improvements for the modular facilities, expansioning of the broadband with a project gigabyte, And my third recommendation is Rural Digital Health Acceleration Program, which combines the online and face-to-face healthcare, where the physician can directly meet the patient, and the patient which addresses the long distance problems and equipment lending programs and education. Uh, then integrating the broader health records, for example, nowadays sorry for now uh, they're only uh, they're only considering a single program or single strategy. Instead of that, they can consider integrating with programs like digital healthcare whales and value based healthcare. Then, followed by the rural workforce stabilization strategy, where giving some subsidies or incentives to the allied health professionals to keep them at the rural areas, keep them working at the rural areas, and also giving part-time professional training to local workforce, so that they can address the staff shortage. And peer support centers like Project Echo stands for Empowering Community Healthcare Outcomes. And my fifth recommendation is community empowerment. It includes widening of the social prescribing. Social prescribing is already present in Wales, even in Powys, but it is not still it is not effective. So complete implementation of the social prescribing is essential, and citizen assemblies and health councils asset based mapping is required. Then what are the expected outcomes if they follow these enhanced quality in health access, sustainable and skilled workforce, better digital inclusivity, increased community ownership, financial sustainability. There are certain challenges also, how it could be mitigated while implementing these. So, if there is a limited initial funding, one can modify the funding formula by testing several models. And disjointed service delivery boards. For example, if only one board is working and it is at the district level, but they are not considering the rural needs, so we can come up with the local governments boards, and make them to plan in a collaborative manner. Digital inequity. For example, older people sometimes, when they don't know how to use it, they get excluded from accessing the digital healthcare. So for them, providing the training and providing the device loans is necessary. And sometimes the recruitment challenges will be there, so one can address it by housing and offering the local training, like a part-time professional training is uh, advised. And these are the metrics for success: enhanced rural based funding, updated facilities, expanded internet access, improved workforce retention, and greater digital skill adoption, increased virtual consultations, decreased and avoidable hospitalizations. So, closing message of this presentation: reforming funding with a focus on a rural specific allocation methods, modernizing infrastructure through modular improvements and expanding broadband access, promoting digital inclusion via blended care provision of devices and training programs, ensuring workforce stability through local training initiatives, relocation incentives, and peer support networks. So, by doing this, it will amplify the community input through co designed services and social prescribing. With strategic investment and collaboration, Powys has a potential to overcome all these challenges that are present. Uh, that are challenge the sorry the present challenges that are persistent in Powys can be addressed by following these recommendations. Thank you.
Thank you very much for that presentation, Sampreetha. Does